Hi, my name is Alyssa Gogol, and this is my Management 401 Sustainability Project in regards to reducing paper usage at nursing care services. The problem I am addressing deals with the amount of paper wasted within the healthcare industry. The healthcare industry is an ever-growing part of our world due to people living longer. All healthcare facilities are required to use agencies when they do not have enough staff to help provide care to consumers. Nursing Care Services is a staffing agency that sends nurses and nursing assistants and aides to facilities that provide care to patients. Hospitals are huge components of the healthcare industry, and studies have shown that nearly 50% of hospitals' waste comes solely from paper. Agencies are a small facet of the healthcare industry, and there is a lot of paper wasting within them as well. NCS, or Nursing Care Services, uses a 95-gallon trash bin for dejected paper, none of which is recycled. I will be focusing on how to lower paper waste within one agency, Nursing Care Services. There are some paradoxes included with trying to reduce paper. While this may be a small change within nursing care services, it can have a big impact. Starting with the office employees changing their ways in regards to paper, then moving upward to the people that work from home, would be the best way to address this issue. Since there is a separation between home and office employees, this reduction of paper usage should be tackled together, thereby working on this problem with unity. Along with these paradoxes come some derailers within this green project. Changing our ways could come with some setbacks because people are used to communicating with facilities in this fashion. Resorting to new methods could make it seem like we're just trying to stay on the going green trend rather than focusing on NCS's profitability, thus potentially becoming a problem child. The employees seem excited to be more environmentally conscious, so failing to produce results could have the potential to derail the entire purpose of this project. Since nursing care services is a service-run based industry, it is going to be important to interact with the facilities in regards to ensuring that new communication methods still meet their needs. This would be meeting with them where they are. This also correlates with collaborate, educate, and network. Without the collaboration between NCS and the facilities, this change will not happen. Education is also a main component of this practice, properly discussing with the employees of new and greener ways of communicating. As mentioned earlier, the staff in the office are willing to make the changes, so practicing planful opportunism is key in this project. Making the necessary changes while everyone within the office is willing and committed is very important to get this green change rolling. While people think of lowering waste in three parts, reducing, reusing, and recycling, lowering paper waste can be best addressed in the first part, reducing. As mentioned before, Nursing Care Services uses a giant trash bin to discard paper, and improperly. To recycle, you need to have waste, but reducing paper is the best way to prevent waste. By trying to reduce paper usage, employees would have to be willing to embrace electronic ways of communicating with facilities, such as calling, emailing, and e-faxing, as opposed to the typical way of faxing. There will have to be some communication with the healthcare facilities that Nursing Care Services works with in regards to finding out the best environmentally smart way to communicate with them. Change is always difficult, especially when trying to change something that has been the same for many years. I had conducted interviews with both the staff and coordinators within Nursing Care Services and also the business owner. The ladies within the office were not only willing to help be more environmentally conscious, but embraced it and were excited about going green. My conversation with the owner of the business was more than willing to reduce paper waste for two reasons: for being environmentally green, and it lowers the amount of paper that needs to be bought for the office. Both of these interviews show that Nursing Care Services is ready for change and for the better. Now it is time to apply the 7 steps for reducing paper usage at nursing care services. The staff has already mentioned that they are willing and committed to changing communication means. The shared vision among all the staff is to provide communication to facilities while reducing the amount of paper used. Determining what will push NCS employees to make this change is to ensure regularity between in-office and at-home employees, and that different means of communicating to facilities is acceptable in regards to assess current realities. Developing strategies for lowering paper usage is easy: reducing, reusing, and recycling. Building the case for change is to show the employees that while this change to reduce paper may be a bit more time-consuming, it still gets the job done in a greener way. Mobilizing commitment is to get both home and office staff to embrace this change, knowing that is for the better, and making it a rule so that paper cannot be used unless it is deemed necessary.